Okay, hello everyone, and as I said, uh, really appreciate everyone taking the time out today to join the webinar that we will be putting on today. We are scheduled for 30 minutes. Just to note your calendars, we should wrap up here about 12:30 Eastern Time. And so today we will be talking about best practices for payer contract negotiation, I should say. Um, and just some quick introductions as far as for your hosts. I'll start. My name is Chris Plant. I am our Senior Vice President of our CR Billmax division. Um, and so that is all essentially our third party, our managed billing services for our Central Reach customers. But just a little background on myself. I've actually been with Central Reach since the company was founded about 12 years ago. Done a lot of work on the software side, and over the last 3 or 4 years have been focused along with Megan here on our Billmax division. So, Megan, you want to introduce yourself?
Thanks, Chris. Welcome back for those of you who have been with us before. For those of you who have never been with us, welcome. My name is Megan Linden. I'm the Director of Operations for CR Billmax. I've been with CR Billmax now going on 5 years. Before that, I was on the platform for about 5 years. So been in the ABA industry almost 10 years now. Before that, on full revenue cycle, everything from intake all the way up to fighting and arguing claims with judges. So it's a pleasure to be here.
Absolutely. Thank you, Megan. And just, Megan, I'll kick it over to you for this, for understanding payer mix.
Great, thanks. So it's also important to note that when you're evaluating your business, it's important to understand when and how to renegotiate your contracts with payers. It's important to note that commercial payer contracts do not typically have rate adjustments unless they are renegotiated by the contract holder. Government payers like TRICARE, state Medicaids, they release rates every year and they are not negotiated. Therefore, it's really important for you to understand the process and how to get those processes started when you are ready. So let's get started. When you start to identify needing to renegotiate your payer contracts, it can be a tedious process. With that said, you don't want to have to complete all renegotiating at the same time. Start with what will have the most significant impact on your business. The best place is to start off by reviewing your revenue. What 3 to 5 payers make up the most of your revenue? Look at how to compare against each other. Do you have some that are significantly higher or lower than the rest of them? It's best to start negotiating the payers with the highest patient volume and the lowest reimbursement rates, as these will have the most impact on your revenue right away. It is also important to look at when the contract was signed or the last date of your renegotiation. Contracts signed within the last 1 to 2 years will most likely not be successful if you're going to renegotiate. Therefore, it's important to focus on contracts that had not had a renegotiation in over 2 years, or if you've never renegotiated your rates. It's actually shocking to find out how many organizations have never renegotiated their rates and they're at the same rate that they signed with years ago. And even though the cost of running their business has increased, cost of living has increased, they've never actually taken the steps to go ahead and renegotiate that. So although timing can be different, you want to look at all those different pieces before you start the renegotiation process.
Yep. And just to piggyback on that a little bit, while Megan mentioned every 2 years or what, that's really ultimately for each organization to determine themselves. So even if the payer may not want to talk to you about it for every 2 or 3 years, that doesn't mean they can't hear from you every year, right? Where you are giving them information as to why the cost of providing the service is continuing to go up, right? So just because from year to year they're not giving you an increase, that doesn't mean. And what you will see, as our one of our last slides is the persistence is really ultimately what is going to be key in showing them the data around, why a increase is ultimately going to be better for their members.
Correct. All right, now we could jump on into understanding average revenue per service. You want to look at everything that's included in your business. If you provide services for multiple specialties, it is important to complete this review for each of those specialties, as all of that will vary depending on your business. First, you want to review all of your codes and make sure that you have fee schedules and reimbursement rates for all billable codes you're rendering services for. In the past 10 years, we've gone from T codes to 9 codes. Some payers still use H codes. They've changed over the years. Old codes have been removed, new codes have been added. You want to make sure during this process you are adding or removing any codes according to the services you are currently rendering at the time of your renegotiation. This will help to ensure you have proper reimbursement for all of the services you are currently rendering. That is why it's important to relook at these steps on an every year basis if needed, because the field is always changing, everything is always changing. You want to make sure that you're capturing as much revenue as you can. Doing this process all the time is what's going to help make sure that you're on top of everything. It also allows you to add codes that might not have been there when you started the contract. You might be using a 037T code, which you weren't using when the contract was first signed. You want to make sure that you're capturing that in the fee schedule and renegotiation to make sure that you are now capturing revenue for your business with those codes. You also want to compare your rates for the same codes across all of your pairs you're reviewing. Notice if they are close to each other or if they are drastically different. Note which payer is the highest rate. This is a good benchmark for where you should start negotiating your rates. Compare these rates to your current state and government funded payers. Is your commercial payers reimbursing lower than your Medicaid, or lower than your TRICARE rates? Most Medicaid and TRICARE rates are typically lower than commercial payers. Therefore, if your rates are lower than those than those TRICARE or Medicaid, it's a good benchmark to say you're already underpaying me where the state or the government already sees reimbursement should be. It's a good benchmark to kind of lead into why you deserve to be getting paid higher rates. And not to mention, TRICARE and Medicaid are reevaluated every year, and they are usually typically based off of current living standard, current economic status. So if you can use that information when you're renegotiating in the states that you have Medicaid or TRICARE, you can show how that the government agrees that over year, how those price increases are defendable and are needed to help run your business.
Absolutely. And another thing to keep in mind, if you are in a specific state or if you are in multiple states, it is always an opportune time to think about negotiating your rates when Medicare or Medicaid, excuse me, updates their rates, right? So, for example, recently in Indiana, a Medicaid just updated their rates. Well, if you now find yourself with certain private commercial insurances underneath or under the Medicaid rate, that is a perfect time to now go back to those, those funding sources with the armed with the Medicaid, the new Medicaid rates to potentially increase, the rates with those payers as well, right? So those are the types of opportunities where you really have some concrete data that you can go back to those payers with to negotiate with. So as we get into, hey, ultimately when you go to negotiate your rate, really the payer is not interested in you just telling them they want a higher rate, right? They are going to want you to actually provide what rate you feel like you should the service, what rate is necessary for the service that you are providing, right? And so this is all data that you're going to want to be able to provide to them. The first things, right? And there's obviously a lot of different places that you could start, and every business is different. But one of the things that you need to look at a very high level is, right, what is your actual profit margin, right? And what will it take to get that margin to a sustainable place for your business, right? As we know, and I did a webinar a couple of months ago with respect to revenue cycle, but as we know, in the ABA industry, speech, PTOT, the margins are relatively thin, right? As you all know. And so getting an rate increased from 72 to 78, for example, especially if it is for a high volume service, can go a long way, right? And so that is the whole point of negotiating these rates. But you have to start from a place and be realistic with what you are. What you are proposing to those payers, right? The other item is you usually want to be consistent across payers. So if you are going to Aetna, Blue Cross, Cigna to renegotiate, you generally are going to want to be consistent, with what that rate is that you are requesting, right? And so, so that's kind of a couple of the first steps that you're going to want to look at. Hey, what is ultimately reasonable? What are my margins? And then obviously breaking it down further from your actual margin is, hey, what are my actual overhead costs? What does it cost me to provide this service, right? And you want to look at all of the costs, and because this is data that you can actually present to the funding sources, right? If you have a clinic, the rent, right? Drive time for your staff, PTO for your staff, insurance for your staff. All of these things go into, and ultimately you can get to a number that shows, hey, here is what it costs for me to provide a unit or an hour of 96151, 96152, right? And you want to ultimately break that down by service, right? The specific CPT code, because when you present to the funding source, you are going to need to say, I would like to see an increase of X%, right, for this service, or an actual X dollars for this type of service. So that is, extremely important. And like I said, it needs to be reasonable. If you can present, here is my cost to provide this service, these funding sources understand that you need to be over and above that a certain amount, right? Whether that's 10%, 20%, right? That's ultimately up to you to decide, exactly where you would like to kind of come in with your request. But these are all things that you need to look at, prior to presenting and having the data. The more prepared you can be when you present your case, the better. They get a lot of requests constantly, right, for negotiating. The providers that go to the funding sources organized with all the data around what it is costing them, what inflation, what has happened with inflation over the last 1, 2, 3 years, right, or really since you've last negotiated your rate, even down to things of gas prices in your state, right? If that is, has increased, or if it's above the national average, all of those types of things, that's the type of data that you can bring to the negotiating table when speaking to the various funding sources. All right, so Megan, jump to you for building your case.
Great. As Chris said, you want to be prepared when you're going to these calls, emails, letters, whatever it may be. So how do you build your case? I like to say it's like you're going to court. You want to make sure you have all of your documents in a row. Before you contact the insurance carrier to start these renegotiation processes, you want to make sure that you've gathered everything you need to reduce the chances of slowing down the process, because there will be a lot of back and forth with the carrier. You can expect the process to take time, and you want to limit the amount of delays when possible. Once you've decided your new reimbursement rate based on the information that Chris just went over, you want to continue to gather everything you need to start your renegotiation process. Before you start the process, research each payer. What are you going to work with to determine that specific payer process for renegotiations? You want to see how they do it, what is required. Is it a phone call? Is it contacting your provider rep? Is it an email? Is it a letter? Is there specific forms that they need to start this process? They're all going to be different. You want to make sure that for each one that you're renegotiating for, you understand those processes and follow them to the T. You should also be researching what the payers will need for that process. Who can start the process? Can it start from your office manager, or does it always need to be the contract holder, the person who signed that very initial contract? You also want to look into how long is the process going to take? When can you expect a follow-up? All these things are all things you want to understand while you're building your case. Time is precious, and we want to make sure that we're not wasting it. This will ensure that you have everything you need for each contract you're working on renegotiating. Make sure you've compiled all of your current contract documents, including fee schedule, amendments, the signed contract. All that information is going to be handy to help supporting your current in-network status and your current rates. So if you've already renegotiated it and you've had an amendment or you've had it updated fee schedules, you want to make sure you have the original fee schedule and any changes that have come in as a result of your other renegotiations. Having all of that proof that shows that you've made the progress is important to support your case. You also want to gather all of your supporting documentation, proof of increase of overhead cost of living increases, etc. Anything that can support your need to run a business for reimbursements at higher rates is going to help support your case. After you've gathered everything you need to build the case, start your process based off of the payer requirements. Again, based off of those payer requirements, it could be started with a phone call. It could be started with a friendly email to your provider contract rep. It could be started with a letter. Whatever those may be, take all of that information and start that process. Now, here's the key, right, Chris? You said it at the start. Be persistent. We're all in the business. We've all worked with insurance companies for many, many years at this point. We all know they're in the business of not paying us. So what makes us think that on that first initial phone call or that first initial email that you're going to get a response that, yes, we are so excited to renegotiate those contracts for you? It's probably not likely. So it's important to remember that this process is going to take time. If you don't get a response the first time, if it's not a fast response, they're testing you. They're going to say that most of these people who are going through this process are going to give up, just like when a claim's denied. Some people aren't going to fight it. So what does that mean? They just hold on to the money. If you're not renegotiating it, it's more money in their pockets. They're in the business of not paying us. This process is not going to be any different. They will hold off. They will postpone as much as they can. They're going to do that because most providers, most organizations are going to give up. They're not going to want to put in the time. They might even say no the first time around. Keep going, keep pushing through it. They're hoping that you will give up. Once you've been successful with one, it'll build up your confidence to show that you really can do this and it is actually something that can be done. Just keep doing it, keep putting through it, put everything you can into it because we all know that the hard work out there deserves the right proper reimbursement. This is what's going to get you there every single time. You just have to put in the work.
That is correct, and that is the key. And that's a really good analogy as far as following up on denied claims with insurance companies. And ultimately, persistence is one of the key attributes you need to have when working with commercial insurance. Really, no matter what you're trying to accomplish. And one of the last things, just to piggyback on what Megan was saying as well, and really around this entire process that kind of can sometimes get a little bit missed because generally, providers are extremely excited to get in network with a specific funding source, so they can start receiving referrals and have a much easier process, especially if you've been billing them out of network and those types of things. It is extremely important to also upfront, if and when possible, negotiate the highest possible rate that you can when you first sign your contract with with that funding source. It is, we see a lot of times where providers will simply just accept the rate that is being offered to them, and that is sometimes where there is an opportunity to get a higher rate right from the beginning. This is, in the industry that we are in, they is the demand far exceeds the supply. So anytime a funding source tells you they have enough providers in their network, that is certainly a false statement, right? Because as we know, there is not enough providers everywhere. to provide the amount of service that is needed. So that is certainly something that you have as a negotiating tool, along with all of the other data that you need to negotiate a contract. That's also the similar type of data you can bring when you are looking to go in network for the first time um, with a specific funding source. So as we kind of come to the bottom half of the hour here, as 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 you all know, Megan and I were part of Central Reach, and more specifically the CR Bill Max team. But why Central Reach? When you are thinking about kind of negotiating these rates, it is extremely important for you to have, especially your service data, all in one place, right? Whether it's clinical, your rate, your fee schedule information, all of your service information, how many hours you've provided, compared to authorized hours, all of those different things, right? Central Reach is going to house those all in one place for you. That, of course, you're going to couple with your more of your accounting type information of your costs and things like that. But to be able to have all of that information in one place is extremely key, especially as you get into the negotiating phase and questions are asked or data is asked of you. It's important to turn that data around quickly and in an organized fashion. And that's certainly something that Central Reach is going to be able to allow you to do.
All great points, Chris. So why CR Max? It's great to have a partner who with experts in these types of questions and fields. I've seen a lot of questions within the chat box just along the lines of, hey, this state told me for this particular payer that they don't renegotiate. How do I find out that information? Well, as a CR Max partner, that is stuff that our team does. We will look into that information for you. We will read your contracts and tell you that this is how you renegotiate for your contract. We will help you get prepared with your current information. We will help you look at data and reports to make sure that your fee schedules that you have in the system are accurate so that when you provide that data, you have it. We're partnering it with you. Nobody's alone when you're in with a CR Bill Max client. We help you manage it. We help you answer questions. We will get you answers. And in some cases, we will even help template an email to start the process.
That's great. Thank you, Megan. And just as we start to wrap up here, we will open it up for questions via the chat. With the amount of people that we have on here, I don't think that we can unmute everyone, but you can please still continue to send in your questions, and we'll also keep it open for a minute or two after we complete the webinar. But as a note, and I'm keeping this up on the screen for just a minute or two. As you can see there is a QR code that you could scan and register for our next. And really what Megan just went into around Bill Max is a good segue into kind of the topic of our next webinar is, really navigating the pros, the cons, and considerations of outsourcing. It is not going to just strictly be talking about all Bill Max and why you should use Bill Max. We are really going to talk about what are the pros and cons of doing it in-house, of outsourcing, because there are pros and cons to both approaches, and every organization is different and has different needs. And so while outsourcing may be great for one organization, it may not be for another. So that's what we'll be talking about in our next webinar in about a month. So, we would certainly appreciate your attendance there as well. And just as I said, we'll stay here as you can we still have some folks typing in questions, so we're happy to continue answering those. But as we close out the webinar, we would certainly appreciate, there is a quick, I think 3 or 4 question survey that if you don't mind answering for us, it just helps us kind of shape what content we can bring you next. But so it takes all of about 10 seconds. If you wouldn't mind hanging on and doing that survey for us, we would greatly appreciate it. But I will reiterate that we very much appreciate everyone's time today. Hopefully you, even if you take away a couple different takeaways, we appreciate that you'll be able to do that. And you will see in that survey if there you want to speak to someone more on this topic afterwards, you can answer yes to that question, and we're happy to follow up with you as well. If you want to talk specifically about any of your payers or any of your contracts, we're more than willing to do that as well. So thank you all again. We hope you have a great rest of your Tuesday, and we look forward to speaking with you all again in another month.